77 WABC.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Good morning. Good morning, everybody. Nice to be back and with you with new news. Spent the week at the National Cancer Meetings, the largest radiation meetings worldwide. They were held in Atlanta this week, and we have lots of news. I'm here with John. John, good morning. How are you?
Good morning, Dr. Lederman. How are you?
John is my co-host, and we have Coop and Aaron in the control booth. This is a live program, so you're welcome to call in and ask your questions. Our number at ABC is 1-800-848-9222, 1-800-848-9222. So if you have questions about cancer, treatment, or related topics, please feel free to call in. We also have a free booklet and DVD, which we're happy to send to you if you wish, if you request that. So there's lots of news and also some patients that I want to talk about this week. The National Cancer Meeting is called ASTRO. It's a National Society of Therapeutic Radiation Oncology meetings, and there's thousands of doctors. There's actually very few radiation doctors in America. When I trained, there were only 1,000 in all of the United States.
Wow.
And now there's about 3,000-4,000, so it's still a very exclusive club.
Sure.
And it's a way for doctors to meet each other, see their old friends, and really get updated with new technology, new equipment, and new data. So there was lots of new data out there, and some of the data we've actually talked about in the last month or so. We had some data showing that women don't need a complete axillary dissection for breast cancer. We presented randomized studies showing that instead of having the armpit operated on if you have breast cancer and have the surgeon clean out all the lymph nodes, which can lead to lymphedema and swelling of the arm, that you can just give radiation instead. We spoke about that a few weeks ago.
Right.
And unfortunately, this week I had a woman who had breast cancer. She had 1 of 4 lymph nodes positive, which was enough. We now know that she has lymph node involvement. And I guess they didn't listen to our program, because then the surgeon went in and reoperated on her and took out more and more lymph nodes, which can lead to complications, can lead to pain, can lead to arm swelling. So this program is actually a great program for presenting people the latest cancer news. That's what we tried to do. So we could have saved her that surgery and the complications had only she or her loved ones or surgeon had listened. So we do try to present all the current cancer data, and it is relevant. You never know when it's going to be relevant. This woman walked in, and it was just exactly what we talked about in the weeks before. Another gentleman called me last night, actually, from Connecticut. He has a PSA of 4.95. He's 69 years old. He has no symptoms. His PSA had gone up slightly from the year before. He repeated the PSA several times and was still around there, 4.95, 4.7, 4.8. And he's calling about, what treatment do you offer? And I was telling him that's the whole point of what we do. Some places you walk in the door and it's proton beam. Whatever happens, the answer is proton beam. It's like you go to McDonald's and whatever you want, you're going to
menu's the same.
You're going to get a cheeseburger.
Yeah.
You walk in for breakfast or dinner, or you walk in for a snack, it's a cheeseburger. Well, we don't believe in that. We believe that every man needs custom-tailored treatment that is designed for that man, if it's prostate cancer, or for that person, or for that woman with breast cancer. The treatment should be custom-tailored. It shouldn't be one treatment fits all.
I would hope so. Doc, if I was coming to see you or any other physician, I would hope that you'd take a look at me, assess the situation, sort of, work with me for my specific needs.
Right. So it's one aspect is medically. What do you need? What is the best treatment for you medically? Do you need this or that or the next thing. And then the other thing is, what about psychologically, what's best for you? For example, we have a treatment for prostate cancer that's one treatment. You can come in the morning at 7 o'clock, have a treatment, and be at work at 9 o'clock,
Wow.
and no one would even know about it. I mean, you'll feel fine and carry on your normal life. So the whole point of custom-tailored treatment is not to give one line on the phone, we do this. No, we do what's best for the patient.
Sure.
And the patient should have all the options, and the patient should understand the differences. So when I say that we offer custom-tailored treatment, I really mean it.
Yeah.
And there's a lot of, let's say, sarcastic jokes at the meeting about robotic surgery for prostate cancer. Because robotic surgery, I mean, if you think about Google, they're making that robotic car, and you program the car to go from L.A. to New York, and it drives itself.
Yeah.
Right?
I read about that, sure.
Right? So it can park itself, it can stop in Salt Lake City, whatever you want, it can do, right? By itself.
So I'm told, yeah.
So that's robotic. So there's a lot of sarcastic comments about robotic surgery for prostate cancer because it's not really robotic. So it's a marketing tool and a marketing name. And actually, there's like a pair of gloves, and the surgeon puts his hand in the gloves away from the patient. So the patient is sitting on the table asleep, getting his body opened up, and the surgeon is either next door or around the world or someplace else, and his hands are like in a glove.
Sure, yeah, almost like they do with NASA training.
Okay, so it's remote treatment.
Right.
It's not really robot therapy, it's remote.
Right.
And some of the speakers at the meeting said it's really puppet therapy because you've got your hands in a device like a puppet. And obviously you can't feel the nerves, you don't feel the differences because it's all metal. There's knives and lights and bells and whistles. And there was just a report out from the government saying there was high rates of complications on robotic surgeries, and many people don't even know the rates because many of these complications, they're speculating most of the complications are never reported. One young woman had surgery, and she ended up with a perforated rectum and a perforated bowel. Her surgery was 11 hours. She was sent home, thought she was supposed to be okay. 10 days later, she was readmitted with perforations, and then she was hospitalized for 5 weeks to repair the complications. There's been hundreds of injuries and many deaths related to this Da Vinci robot surgery. And this latest study was published in the Journal for Healthcare Quality. So there's a lot of interesting data out there, and people can choose to listen to it or ignore it. But there is data out there, and it is intriguing data. And then I was directed to an internet site of a surgeon in New York who's promoting robot or puppet therapy for prostate cancer. And he's talking about thousands of successful surgeries, 97% cure rate, 96% regained continence. And if 96% regain continence, it means there's a lot of people who are losing continence.
Yep.
And 85% regaining sexual function. Now, when you talk to the patient themselves, it's exactly the opposite. With robotic or puppet therapy, a study from Harvard which interviewed men. So men were asked themselves what are the complications from robotic or puppet therapy. And with incontinence, meaning leakage of urine, only 13% of men said they had no problem, which means that 87% of men had leakage of urine problems with robotic or puppet therapy. And with sexual function, which is obviously important to many men and their spouses and their loved ones, only 2.3% of robotic-operated men reported no problems, which means that 98% of men had problems. So it's intriguing that on the internet site how they're promoting all these great statistics, but actually when you talk to the men themselves, it's exactly the opposite.
Yeah, certainly.
So it's certainly something to think about. The prostate sits between the bladder and the rectum on either side of the nerves. Men who choose to have surgery have a big operation. It's like filleting the fish and then putting the fish back together again. And if you look at the best data, for example, for a man with excuse me, for a man with a PSA of 4 to 10. PSA is the blood test. In the best hands, 5-year cancer-free survival is 82%. With us, it's 90%. So we're 10% better, and our work is non-invasive. There's no opening up the patient and filleting the fish. So it's certainly something to talk about. And furthermore, there's studies that showing sometimes the latest machine, the latest gizmo, when it's studied better, is disproven, and yet hundreds of people, thousands of people go through it before those studies come out. And there is no randomized studies with robotic therapy. So it's a lot of hype.
A lot of hype, a lot of popularity, a lot of trend.
There's a lot of trend.
Like,
it's one of the most popular treatments because people think the latest gizmo is the best treatment.
Right. New is always better.
And we had that study in New England Journal which showed that actually 50% of the time the latest gizmo isn't as good as the prior treatment. So we encourage men to really investigate and look into what kind of treatment they're going to get, what's the real complication rates, and see someone, get a second opinion, get a fresh second opinion, someone unrelated to that surgeon, go to see someone else. I often say it's like when you go to the dentist and he says you have a cavity, and maybe you have a cavity that needs to be filled. Maybe there's a motivation to fill that cavity or fill that tooth regardless.
Yeah.
So when I go to the dentist, I say, look, here's $200. Tell me what I have. If it's a cavity, let's fix it for $200. If it's a no cavity, I'd rather give you $200 and have no cavity.
Sure.
So sometimes there's a conflict of interest in medicine, and we should recognize that and deal with that and try to find the best data and the best treatment for a patient regardless of the situation.
Yeah, certainly.
And just because something's new or hyped doesn't mean it's new and better. So there's a lot of interesting other data out here. At another man, which I've talked about on the show also, a 50-year-old with esophageal cancer, and he had surgery and treatment at one of the leading hospitals in New York, and the cancer came back. It spread to a rib, which was terribly painful. So he got his treatment with us about 3 months ago and just came back for a PET scan to evaluate the response. And actually, we treated several sites in him that were painful, and all the sites we treated got better. Good. So he just came in yesterday, had the new PET scan. We gave him a copy of the images, which I like to do. I like patients to have a disc with their images and the report. And I tell people it's really important to keep a notebook or keep a file of your particular cancer so that years later you know what's happened to you and know the treatment, and you almost need a diary.
Almost like a log, a medical log.
You need a medical log. And so people who do that are better informed. They get better care because they've got all the data at their fingertips. Sure. So we spend a lot of time with our patients just getting them the data from the last year. You know, what's happened to them. We call the pathologist and the surgeons and the medical oncologists to try to get people in their hands the data.
Yeah, a lot of studying, if you will.
When you leave the radiologists that work with us, you have a disc in your hand. Actually, you usually have several discs in your hand, and you keep those. Or if you go see a second opinion, you can give the disc, this is me.
Right.
So there's a lot of things.
Certainly helpful, yeah.
There's a lot of things you can do that make your treatment potentially better. Again, we're live at ABC. Our studio is next to our office in Manhattan. Our office is at 38th and Broadway in Manhattan. We have an independent cancer center. We take most insurances, Medicare, Medicaid, which people always ask. We have a booklet and a DVD that we send out for free if you call us. You can either call the show and ask your questions, or I'll give you our direct line later in the show. The show is 1-800-848-9222, 1-800-848-9222. We had several patients coming in this week from far away, one from California and one from Pakistan, with acoustic neuromas. So we don't only treat cancer. Sometimes we treat non-malignant diseases, and one of them is acoustic neuroma, which is a benign condition of the eighth nerve. It often causes hearing loss or imbalance. So actually I had another patient who came in this week with hearing loss and imbalance and was never diagnosed. He had an MRI of the brain 2 years ago, but they didn't do a contrast study. Contrast is an injection in the vein at the same time.
Sure.
And the tumor takes up the contrast